Hi, my name is Renee Nunez, and I am presenting my Module 8 Medical Terminology Emergency Simulation as a scribe. The scenario is reported from the paramedics that the patient, Don Smith, DOB, his date of birth was July 1st, 1985. He was an unrestrained driver in a motor vehicle accident about 20 minutes ago. His chief complaint was pain in the lower left quadrant of his abdomen, pain in his left arm, leg, and head. The patient denies any loss of consciousness or dizziness. His vitals, his BP was 165/84. His pulse was 108. His breaths per minute were 24. His temperature is 96.8 and pulse ox was at 98%. He had splints placed on him at the scene on his left leg, and his left arm was in a sling when he arrived, and his head was wrapped with gauze with signs of blood. I will begin with the integumentary system, which includes the hair, which is the trach, skin, derm, and nails, onyx. The musculoskeletal system includes the bones, osteo, and joints, arthro or articulo. The cardiovascular system includes the heart, cardio, blood vessels, vasculo, arteries, arterio, and veins, veno. The respiratory system includes the nasal cavity, naso or rhino, the pharynx, pharyngo, the larynx, laryngo, trachea, tracheo, bronchial tubes, bronchio, broncho, bronchio, and bronchiolo. The lungs, pneumono, pulmono. The digestive system includes the anus, ano, the esophagus, esophago, gallbladder, cholecysto, liver, hepato, mouth, oro, pancreas, pancreato, pharynx, pharyngo, salivary glands, cystindeno, small intestines, entero, and the stomach, gastro. The reproductive system for males includes the andro, is male, the testes, testiculo, epididymis, epidemio, penis, peno, vas deferens, vaso, seminal vesicles, vesculo, prostate gland, prostate-o, female, gyneco, ovaries, oophorio, uterine tubes, salpingo, uterus, utero, vagina, colpo, the vulva, espizio, and breast, masto. The endocrine system is comprised of the adrenal glands, adrenalo, ovaries, ovario, pancreas, pancreato, parathyroid gland, parathyroid-o, pineal gland, pineal-o, pituitary gland, pituita-o, pituitary-o, the testes, testiculo, thymus gland, thymo, and the thyroid gland, thyro or thyroido. The nervous system consists of the brain, encephalo, spinal cord, myelo, and the nerves, neuro. My initial observations of this patient was that he had a cut above his nose with the bump 2 centimeters laterally to the cut. The superficial cut to the forehead was proximal to the nose, and a bump 2 centimeters lateral to the cut. The elbow area was black and blue with signs of bone pushing out on the skin. Mr. Smith suffered an open fracture or compound fracture. There is discoloration in the abdomen area of the pain. Mr. Smith suffered a contusion causing ecchymosis in the lower left quadrant of the abdomen. Mr. Smith will need further testing. Discoloration of the knee area appears enlarged. It is suspected that Mr. Smith has a closed fracture or simple fracture and will need x-rays to confirm the diagnosis. Mr. Smith has a possible concussion and will need further testing. Symptoms to monitor cephalgia or headache, vertigo, which is dizziness, nausea, emesis, vomiting, and blurred vision. It also is important to consider his history. He has diabetes type 1, which is an insulin-dependent diabetes mellitus, high blood pressure, hypertension, high cholesterol, atherosclerosis, curvature of the spine. It could be kyphosis, lordosis, or scoliosis. It is not determined. He has asthma. He has GERD, which is gastroesophageal reflux disease. He has kidney stones, which are nephrolith, and he suffers from depression and anxiety. My assessment and recommendation is that Mr. Smith was seen in the emergency department due to an auto accident. He is complaining of pain in his lower left quadrant that sustained a contusion that should be evaluated further with a CT scan and ultrasound. Mr. Smith has an open fracture to his elbow that will need further treatment and an x-ray of the area that is to be treated. The superficial cut to his forehead is in need of suturing and a CT scan. He should be monitored for possible concussion. Mr. Smith should be followed closely due to diabetes type 1 and high infection rates.